everyone, welcome to another episode of Before and Beyond. I'm Dr. Joanne from Dental Designs, and today we're going to talk about dental abscesses in kids. A dental abscess can be super worrying for both the kids and the parents. These are actually infections that form at the root of the tooth. They are often because of untreated decay, maybe a trauma to the tooth. It can happen in both the baby teeth and the adult teeth. So what does a dental abscess look like? Often it looks like a little pimple above the tooth and it's on the gum, something like this in the photo. It can be accompanied by a loose tooth, a painful tooth, or like a foul taste in the mouth. So sometimes your kid might say, hey, there's something that tastes bad, or my tooth is really painful or loose. Those are signs to look out for. In this case in particular, this child actually had this pimple for a few weeks. It was totally painless, no pus, no nothing. It was just an incidental finding at his regular checkup. When I first see cases like this, the first thing to do is to diagnose again. What I usually do would be to check the tooth for any signs of nerve damage. I would take an x-ray to see what's going on inside the tooth and check for any decay or any fractures inside the tooth. So one really important thing to take note is whether it's a baby tooth or it's an adult tooth, because this will definitely change how we treat the situation. So in this case in particular, it was actually a baby tooth, and you can see that over here it actually has the adult tooth just underneath it, and this black space right in the middle, that's the sign of infection underneath the baby tooth. So what we're worried about is that the infection will actually spread to the permanent tooth, and it can cause damage to its eruption or to the formation of the tooth itself. So treatment, it really just depends on the severity of the situation and how old your child is. If the infection is caught early, we still might be able to save the tooth, especially for a younger child where we want to keep the baby tooth to maintain the proper space and alignment. In the case where the tooth is too far damaged or the tooth is about to fall out because your child is getting to that age, for example, like in this case here, there's very little root left behind, and the tooth is about ready to come out, it just makes sense to extract it earlier. So what I always tell parents is to always check for their child's tooth, its color, and ask your child whether there's any pain when he's eating. Also lift up the lip and check for the gums for any pimples like these. Even more so when your child has had a fall or had a trauma to the tooth. It can happen a few days after the fall, it can happen a few weeks, even up to a few months. So always lift up the lid and have a look. So thank you so much for watching Before and Beyond. I hope you learned something today, and I'll see you in the next episode.